Hey everybody, this is Dr. Matt Ogle with Highland Chiropractic, and this is the Perfect Storm Optimizing Neurodevelopment. This is one of our community workshops that we put on to help parents, professionals, and whoever else is listening to this really kind of gain an understanding of what chiropractic is, how we can optimize neurodevelopment, and essentially, beyond just what we talk about here is what can you do in your home to help see significant changes in optimizing neurodevelopment. So first off, my name, as I said, is Dr. Matt Ogle. I'm a pediatric and family chiropractor. I'm a family man. I am a husband and a dad to 3 kids. Preston is 5, Oakley is 3, and Quincy is 8 weeks old, so pretty new. I am a doctor, and I love the fact that doctor means teacher, and teaching is one of my favorite things to do in helping people understand and really empower people with knowledge on the things that they can do or the things that you can do to optimize your health, to optimize neurodevelopment in children, and I hope that you gain something from this presentation. So, like I said, I'm with Highland Chiropractic, and pediatrics and family wellness and pregnancy is our focus. We have quite a few patients that we see that are on the spectrum, ADHD, acid reflux, colic, all of these childhood quote-unquote conditions. We also care for kids that have issues with bedwetting, seizures, headaches, constipation, ear infections. Throughout this presentation, you'll see how it is that chiropractic can help with that, and a little bit more. So to start off, our goal is to understand what is the most overlooked cause to pediatric conditions. What is it that is one of the driving factors or one of the biggest causes to these pediatric conditions? And I want you to be able to understand, how does the nervous system fit into all this? And then also what you can do about it. So what can you do about it? And I'm going to give you a few things here in the end for what you can do to immediately see results and changes. Okay. So what is the most overlooked cause to neurodevelopmental conditions? It isn't something that we're going to be focusing on here. We're not going to be talking about genetics. This is not a genetics problem. Even the best research in the world shows that genetics plays such a minor role. And while I know that there's research coming out with checking genetic markers for autism, for sensory issues, I'm not really concerned about that too much. There's genetics, and then there's epigenetics, and I think that what should concern us more is epigenetics and what is expressed from our gene code. And we can have an influence on what is expressed from our gene code by the things that we eat, the things that we do, the activities that we do, and our surroundings. And so I don't want to focus on genetics. I want to focus on really something that we can have control of. And so the part that genetics has to do with the neurodevelopment, obviously, is 2 cells united once upon a time, right? They then divided, and over a trillion times they divided to create what we know as, the human body. And 2.5 weeks after conception, the brain and the spinal cord are developed. So this is essential for us to understand in the neurodevelopment of each child, is that in the womb, pretty much one of the first things to develop as far as organ system is the nervous system. So the nervous system is in control of everything. It controls the brain and the spinal cord control the entire body through the spinal cord, the nerves that go out from there. So after 11 weeks, everything's ready to go. The nervous system is set in place, and it is ready to help grow and develop the body. So the process is all considered pretty perfect, and honestly, it's a miracle, the fact that this can happen. But as long as nothing interferes with it, I mean, we will have optimal development as long as there's nothing that interferes with the development, right? And so 3 things that we look for specifically with our practice members, whether they be kids or adults: traumas, thoughts, and toxins. These are all stressors to the human body, stressors to the nervous system, and can all have a huge role in the neurodevelopment of a child and of the of just the function of an adult. But as we're talking about children, we need to dive in and find out, what are these traumas, what are these toxins, what are these thoughts, and how can we eliminate these stressors so that this child can grow without the stress. So we'll talk a little bit about that, but this is a picture here so that you can see that the nervous system literally controls everything in the body. The brain controls the body through the spinal cord and the nerves that go out from it. Okay, and I know that it's kind of a fuzzy picture, and I can always send you guys another one. But this is really where we get to see the connection between the nervous system and the organ function, and the tissue function, and the gland function. Okay, so before we get started anymore, I guess we already started. Before we go any further, I want to take an awareness test with you, and this is an awareness test to kind of get us all on the same page before we start diving in deep. So let me get this started here.
This is an awareness test.
Okay, here we go.
How many passes does the team in white make?
Go!
Okay. The answer is 13.
Who got it? Who got it?
But did you see the moonwalking bear?
Wait, what?
Go!
Okay, we're looking for the moonwalking bear now. Where is the bear? Okay. So why did we not see it when we first watched the video? We were told to look at how many passes the team in white made. So it's easy to miss something that you're not looking for, right? And what I'm going to suggest to you is that what we're going to be talking about here heavily in the next few slides is this is something that we are missing. This is something that is right under our nose, and we are completely missing it. Okay? Now let me put out a situation for you. And think about, if you have kids, think about when that first baby or your most recent baby came into this world. If I were to come visit you at your house, say after you came home from the hospital or birthing center, or even if you had a home birth, if I were to come visit you after baby was born, and you trusted me enough, and I asked, hey, can I hold her? Can I hold him? You would probably say, yeah, absolutely. And if I were to take that baby by their head and lift them out of their car seat or out of their bouncer or out of your arms, what would you do to me? And my best guess, and what I've been told most often, is I would be laid out immediately. I would be knocked out unconscious. Okay, and my question is, why? Why would you care if I lift your baby up by their head? Because the fact of the matter is, there is birth trauma that is no different than just lifting your baby by their head. It takes 60 to 90 pounds of pressure to pull on the head, to pull on the spine. We call it axial traction, which basically means, like, if you're sitting there in your seat right now, if you were to pull up on your neck, that is axial traction. So it takes 60 to 90 pounds of axial traction or of pressure put on the spine to bring a baby into this world. Now this is average. Some come out easier, some come out a little bit harder. But the point of the matter is that how is it any different from me picking up your baby by the head and that baby being delivered? And the truth is, it's not much different. Now, I do not advocate grabbing babies by their head. We are trying to eliminate the trauma that is caused by the birth. But the other thing to consider is, whether it's C-section, normal birth, forceps, or vacuum. But almost all of the neurodevelopmental cases that we've seen in our office can be traced back to the birth process. Okay. So, in his research, Dr. Gutman, who's a medical doctor, he found that spinal injury was present in 80% of the 1,000 children or infants that he examined right after birth. And this spinal injury caused interference to neurologic and immune function. Now, this is significant because what we understand now is that spinal injury can cause interference to neurologic and immune function. And if that's the case, then if we're causing interference to the neurologic function, what is that doing for our development? And if we're causing interference to the immune function, what does that potentially do to this child's immune system? And how well is this child going to grow and develop the way that they need to? So he concluded that upper cervical or the upper neck should be examined after all births. And if that baby has subluxation, that word up here, the interference to the nervous system and immune system, if that baby has subluxation, then it should be corrected immediately. And that will give the baby a greater chance as far as optimizing the nervous system and immune system function. So, the trauma from the birth process remains an underpublicized and therefore significantly undertreated problem. And the reason, and just to give an example, if you think about, have you heard about this before? Before you watch this or before you came to one of our workshops, have you ever thought about this as being an issue for the neurodevelopment of a child? And 90% or 98% will say no. And so this is clearly underpublicized and definitely undertreated. Now, where does it all start? When we talk about neurodevelopment, we're not just talking about kids that are on the spectrum. We're not talking about kids with PDD and OS. We're not talking about just these sensory issues. We're talking about things like ear infections, asthma, constipation, a bunch of other health challenges that are in children. Seizures. What we want to do is we want to focus on where does it all start? And is there something that we can do to remove one of the causative factors? So this next video here is to kind of illustrate where it starts. And if you are queasy, then please don't watch. Just fast forward about a minute ahead, okay? So that there is the vacuum on the crown of the baby's head. So that's pulling out, and they disconnect it. And I want you to pay attention to the neck. Okay. All right. So here, let me go back there. So where it all starts is the birth process. Now, look, I'm not pointing fingers. This is something that needs to happen. This, at least sometimes, maybe our C-section rate is up a little bit higher than it should be. But baby's got to come into this world, and I'm grateful for the medical insight and knowledge that we have to have this possible. If it wasn't for this knowledge and this insight in how to help patients, I would not have my wife with me today. I would not have my 5-year-old son with me today. He was born via emergency C-section after 40 hours of labor and 4.5 hours of pushing. That dude was stuck. He's got a noggin like nobody's ever seen. At least he did when he's growing into it. But that sucker was like an orange on a toothpick. His head was huge, and so it was stuck. And it went into fetal distress, and fortunately we had, medical intervention to help us out. Now, moving on. Just a side note, it's not only C-sections that we see birth trauma in. Even a totally natural, uncomplicated birth can result in subluxation. Even a birth where you've got your incense or essential oils and your diffusers or whatever you have, and your Bob Marley playing, if you're into that, if that calms you down. Even in that case, your child, or I guess not even your child, depends on who you're watching this for, but that child can actually get a subluxation. Sorry. So on the bottom right here, this is a picture of my daughter Quincy, and she is about 20 minutes old there, and I checked her for subluxation in the upper neck because she was born via C-section as well. And so I checked her, and sure enough, she had a subluxation in the upper neck, which I adjusted. And I adjusted it with the pressure that it takes to check a tomato or check an avocado in the grocery store. It's very light, it's very specific, and that's what we're trained to do. So, subluxation. I've mentioned subluxation a couple times, and I want you to understand what subluxation is a little bit more before we go on. So there's three main components. There are three main components of subluxation. Now, subluxation occurs when a joint becomes 1, misaligned, 2, fixated, or misaligned and then fixated. And when it becomes fixated, it loses its ability to move through the range of motion that it needs to in order to allow the proper communication from the brain to the body and the body to the brain. And so this picture on the right side is just to show how a simple misalignment in the upper neck can cause interference with the vertebral artery, the blood supply into the brain, but also the brain stem is right here, right within the skull, and everything, every sensory, every feeling that we have, pain, temperature, whatever it may be, all of that information goes into the spinal cord, through the upper neck, passes right through this area into the brainstem, which then the brainstem kind of sends it out to all the rest of the areas. Now, what we know is if there's an issue here in the right below the brainstem, causing abnormal neurological input into the brain, then that is actually having a negative impact on the health of that brain, or the input going to that brain, which if we have abnormal input going into the brain, then we're probably going to have abnormal output. And I'm getting ahead of myself, but we're going to get to that here right now. So to understand the neurological component to the subluxation, remember we have a misalignment, a fixation, and then the neurological imbalance. And if you think about the most active person that you know, and think about trying to put that person in a straitjacket, okay? And doing this would cause frustration, it would cause possibly anxiety. But the point I'm trying to make is that we need to move. Our brains need the food from movement to feed it. So these are a bunch of fancy words that you don't need to necessarily know. I'm going to explain this, how it works. So dyskinesia is abnormal movement. Okay, so we have abnormal movement because we have a misalignment. So with this abnormal movement, if we have decreased proper movement range of motion, then we have abnormal input going into the brain. And if we're talking about, especially with this, we're talking about in the upper neck, because in the upper neck, that's where all of the information from the body, all the information that our body gathers goes up through the spinal cord into the brain. Okay, hope you're following me on this. If you need to take a little break, go ahead and take a break, pause it, but we're going to keep on going. So disafferentation. This is abnormal information going into the brain, which if we have, like I said in the last slide, if we have abnormal information going into the brain, then we are going to have abnormal information going out. But what we call the effect of the abnormal neural input into the brain, we call it sympathetic overdrive, or what it causes is sympathetic overdrive. And this causes it's called dysautonomia. And autonomia is just basically the automatic functions of the body. And those will typically happen normally and regularly if they're not interfered with. Things like breathing, you don't have to think about your heart beating, you don't have to think about digesting foods, or making sure that the minerals and vitamins are absorbed in your gut. Now, when we have a disturbance in the autonomic system, or the automatic nervous system, we have an increase in the sympathetic nervous system, which they are inverse. And we're going to get a little bit more information here on this in just a few slides. But what this causes is sympathetic overdrive. Just think of that as stress. So we have an abnormal alignment or fixation, which is causing different information or kind of a static signal going into the brain, or abnormal neural input in the brain. This is causing a stressful situation to the brain and really to the overall body. And this is causing what we end up seeing is the symptoms. Okay, the symptoms are really what we're seeing as the cause. Okay, so we're going to talk about subluxation, the neurological, let me see. So the neurological component of the subluxation is right here. And these are 4 fancy words. We call these the 4 Ds. You don't need to memorize these words, but I'm going to explain how this works. And I kind of did in the last slide there. But this is the most crucial and the most troublesome component of the subluxation. Because what we know is that dyskinesia, which is abnormal alignment and fixation, dyskinesia or abnormal movement causes disafferentation. And afferentation is input going into the brain. And if we have abnormal input going into the brain, then the brain is looking at that and processing it. And what happens is the brain looks at this information coming in and it perceives it as stressful because it's not what the brain needs. And so this is what we call sympathetic overdrive, which we'll touch on here pretty quick. So the brain is then stressed out, and if our brains are stressed out, or that's what our body is perceiving is happening, then we are going to have abnormal energy output and control. And this abnormal output and control is really where is synonymous with symptoms. Okay, whatever the symptoms are, this is really where we see these kids that have neurodevelopmental issues, or even, like I said previously, even issues like ear infections and colic. I mean, this is dyskinesis. This is abnormal output for the body. By definition, dyskinesis is reversible. And so we know that we can go from dyskinesis, we can fix and change the sympathetic overdrive, we can change the input going into the brain by aligning the spine and eliminating the fixation. And really eliminating the fixation is what we want to do in order to restore this neurological imbalance. So again, abnormal alignment fixation causes abnormal input into the brain, which the brain perceives as stress, so it then thinks the body is stressed, and then it causes abnormal energy output for us to see, that we see, and sometimes that we don't see. And so your brain is fed through movement. We need to move, and 60% of the nerves that pick up movement, the movement food, live in the spine, and 33% of those nerves alone are from the upper neck. So we know that movement is life. We need to move. And the power of the chiropractic adjustment is essentially to remove the interference to the nervous system by restoring proper movement and function to the spine. So we talked about dyskinesia, the abnormal movement and fixation. The chiropractic adjustment restores proper alignment and movement. And what this ends, it's just a waterfall of events, because this then restores the proper incoming flow of proprioception, which is movement, or the ability that I have to tell where my body is in space at any time. So we're then improving the disafferentation. This then balances out the autonomic or the automatic nervous system, which calms down the sympathetics or the stress that these children's bodies are under. And it allows a restoration of energy output and organization to normal again. Okay, because before it was just basically pedal to the metal, just hardcore stress. And so the chiropractic adjustment allows us to remove this interference, to allow the body to function properly, to allow our bodies to perceive and coordinate and integrate all the information that it has coming in every single second. So how do I know if my child has one of these subluxations? And that's a good question. We're very specific with what we do. We are different than a lot of chiropractic offices, but we use the latest technology. It's state-of-the-art equipment, and it's NASA space certified. This is what the astronauts use. But there's no radiation with it, no pain, no needles, no pricks, anything like that. We're not drawing any blood. So this is completely safe for children, and this is an example of what the scan, of what a scan looks like. So again, the nervous system, it's basically the air traffic controller. It processes trillions of bits of information each second. It's somewhere around 7 to 11 trillion, which is just a massive number. And we are consciously aware of 50 bits of information. Now, the nervous system relays information on the body status back to the brain, and then the brain then will coordinate everything that it's being told, and then send signals out to the proper glands, hormones, tissues, what have you. So the nervous system, like we said before, controls everything, literally everything. So two resulting components of subluxation are right here. One, we talked about sympathetic overdrive, and two, it causes a poorly organized nervous system. And both of these need to be addressed in that order in order to see an improvement in the neurodevelopment of a child. So we're going to talk about sympathetic overdrive. And sympathetics, like I said, is stress. That is stress to the body. And an easy way to think about this is sympathetic is gas pedal, parasympathetic, which is the resting and digesting. Parasympathetics is the brake pedal. So we're either on the gas or we're on the brake. Either we're all the way on the gas or we're all the way on the brake. There's no happy medium, or there is a happy medium and we need to find that, but we can't be on the gas and the brake at the same time. That would ruin the car, right? That would burn some stuff up. So the sympathetic nervous system is specifically designed for us to help us get out of stressful situations, to fight or flight, and it's intended for short periods of time. Now, parasympathetics, on the other hand, is what a lot of you will feel after big family dinners, after Thanksgiving dinner. You just want to kind of go and relax and grow and develop as you take a nap. So we really should spend most of our time here. So what we want to do is optimize how often or how long a child is in this growth and development phase or stage. And there's an ebb and flow to it daily, but the parasympathetics really has the most significant impact on the immune system, on the digestive system, and on the endocrine system. So this is where we see growth and development, okay? This is where we want to be. This is where we want the kids to be. We don't want them to be stuck over here on the gas pedal, flying down the freeway at 100 miles an hour, just stressed out of their minds. Now, the presentation of sympathetic overdrive couple listed here: hyperactivity, recurrent sickness, impulsiveness, behavioral issues, sensory, and also even the quote-unquote normal kids or kids that are asymptomatic that come into our office. Sometimes we will still find subluxation that we can address and remove and take care of. Now, this scan to the right here is a scan of a little girl. She is 7 months old, and she came in because, well, she didn't come in. Her mom brought her in because she had some birth trauma, torticollis, was having trouble sleeping, also reflux was an issue as well. And this is an example of a very stressed out nervous system. This is an example of what it looks like when there's sympathetic overdrive. So after evaluation and going over the results with the parents, what we know is that there was definitely something that we could do to help them. Okay, we could help them. We could help their child at least achieve optimal nerve system function. And so we did that by adjusting her. And the first visit, I just adjusted one area right up here in the upper neck. And I had her mom hold her. And as her mom was holding her, I adjusted right up here. And immediately after the adjustment, she face planted under her mom's shoulder. And her mom looks down at her like, oh my goodness, what have you done? What happened to my baby? And this shows us that this is a perfect example for showing what an adjustment can do in restoring neurological input into the brain. So we were able to remove that sympathetic overdrive factor in the upper neck for a short time. Okay, this isn't something that lasts forever unless we go through a corrective treatment. But by removing this interference for a little bit, her body was able to have just a little bit of relaxation, more than it had had before, and allowed her body to relax and fall asleep. So, pretty awesome stuff. Pretty incredible stuff. The second component to all of this is the poorly organized nervous system. Remember, the role of the nervous system is to perceive the environment and coordinate the behavior of all the other cells in the body. Now, why am I not talking about pain? I'm not talking about low back pain, neck pain, and any issues like that. Why am I not doing that? Well, I know that there's more to the spine than just bones, muscles, and ligaments. There is a neurological component, and that is what I'm focused on more. That's what I care about a little bit more. Now, we do a great job at helping low back pain, neck pain, migraines, headaches, and things like that, where you can actually feel it. But what I'm about more than pain is I'm about optimizing nerve system function. Now, the principles of chiropractic, these are the top three. One, your body is made to heal, and it's meant to be well, not sick. Okay, and the nervous system controls everything in the body, which you know by now because you've heard that about 9 times. But interference to the nervous system is what we call subluxation, and this causes dysfunction in the nervous system. Now, I want to cover a couple things that we can do now. What can we do now to get things moving? What are some action steps for success, as I say? So, the first thing, proper exercise and fitness is such a huge component in allowing proper neurodevelopment, not only for babies, allowing them to crawl as long as they want to, but also for these older kids, is allowing them to get the exercise that they need. And we don't need to call it exercise, just have them go play. Because right now, the kids in the U.S. are spending 4 to 7 minutes per day outside. That's it. So we need to increase the activities. We need to increase we need to push them to go outside, go do something, be creative, build a fort, climb trees, do all of these activities outside, increase how much exercise they're getting. See, the adjustment is very specific to a segmental dysfunction. And you can think of that as a segmental exercise. Now, exercise in and of itself is kind of a global adjustment to where we're moving the entire body, because we know that the brain is fed through movement. Okay. So the next thing that we can do is evaluate the electronic toxicity in our homes and in each of our lives. the kids are glued to the electronics these days. You look at kids and they're just in a complete different zone when they're on the iPhone, iPad, tablet. You know, these kids are meant to create and to imagine, and not necessarily to have it created and imagined for themselves, for them already. So these kids, and it says especially with these kids with Ferrari brains, and I call the kids with Ferrari brains those who, you know, they're very active, and these are more of the hyperactive. But you know, unfortunately, these kids, they get hooked on these games and need to go to the next level and this, that, and the other. And maybe maybe they're learning that from their parents or who they're around most of the time. So definitely something to evaluate, because when a child is plugged into one of these tablets or phones or devices, their sympathetic nervous system, remember their fight or flight nervous system, actually engages. And this is, you know, science shows that the areas in the brain that have to do with creativity, imagination, and organization, they go absolutely dormant. That, you know, there's no need to be creative or imagine or organize anything if you're just staring at this tablet and watching, whether it be a show or a game. And, you know, we can make the argument that, hey, well, you know, we're working on hand-eye coordination, right? But the truth is, you know, what part of the brain are we actually exercising when we do those things? Next thing is, these are, you know, we talked about traumas, thoughts, and toxins, and nutritional and environmental toxins are significant in the growth and development of a child. And unfortunately, kids, their diets are completely messed up. As a baby, breast milk is dependent on the diet of a mom, so whatever mom's eating is what baby's eating. And, you know, if we're putting the child on formula, they're mostly getting sugar anyway. And most of them are derived from cow's milk, and we'll talk about that in a sec. But cow's milk and cereal grains are the first foods for kids, and there's definitely room for improvement there. And we know that food can be our medicine. And if we have the proper food and nutrients, that we can improve behavior, we can improve immune function and neurological function faster than trying to train the kid, you know, in some different type of way. So diet is huge. The problem with milk, and I'm not here to just preach completely against milk, you know, do what you want, but the main issue with milk is this: these cows that are, you know, cooped up, they are taking antibiotics and hormones so that they can produce more, taking the antibiotics so that they don't get quote unquote sick. The milk, the proteins in the milk themselves are actually changed a little bit with the pasteurization and homogenization process. Because anytime, like if you cook an egg, if you take an egg, it looks different when it's raw than from when it's cooked. And when it's raw, the proteins are a little bit different than they are when they're cooked. Same thing with milk, the proteins are being changed. And this is where we see a lot of immune system issues, is because proteins are being changed, they're not being recognized by the body. Hormones are in the body now, antibiotics are in the body now. Just like we said, you know, whatever mom drinks is what baby drinks, or whatever mom eats is what baby eats. Same thing. We're eating or drinking whatever the cow is eating or being fed. Hormones, antibiotics. And those are the main concerns for us. And little Miss Cow here says, even we don't drink milk after we're weaned. So just a little bit on that. So the next part is, what about grains? And if you have a kid on the spectrum, you've probably already heard of the gluten-free, gluten-free, casein-free diet. But the main thing to consider is that grains turn into sugar, and sugar stimulates the sympathetic nervous system, which is the stressful nervous system, or the stress side of the nervous system. So if we want to really optimize the function, we're going to decrease the grains, we're going to decrease the sugars, if not eliminate them altogether. So environmental toxins are play a huge role in neurodevelopment, because the smallest little toxin can have, or smallest little bit of toxin or what have you, can have the largest impact on a child. Think of it like this. If you were to take cinnamon oil and just dip a toothpick in that oil, just the smallest part of the toothpick into the oil, and then put that on your tongue, at first you'd be like, yeah, it's not too bad, and then give it a few seconds, and then finally it starts spreading, and then all of a sudden, oh my goodness, your tongue is on fire. So in 2004, there was research done analyzing the umbilical cord blood from 10 kids, or 10 newborns, born in August through September throughout the entire US. They tested for 400 specific chemicals, and they found, of those 400 specific chemicals, and these chemicals they decided on because they were dangerous to the body, they were dangerous to neurodevelopment, they cause cancer and birth defects. So of the 400, 287 were found, and 180 are known carcinogens, 217 are toxic to the brain and the nervous system, and then 207 of those cause birth defects. So clearly our environmental toxins, not only the foods that we eat, but what are we around? Are we around smoke? Are we around dirty areas? Are we around, pollution? And some of these things we have control of, and others we don't have as much control of. And so we do our best to decrease the amount of toxins that come into our body. So kids are extremely deficient, not only in these things, but one other thing I want to add to this list. Omega-3s, plants, and the phytonutrients that come from plants, and also clean water. Check your city's water to see what they add into the water. And then once you see the additives, check those out and see if any of those are neurotoxic, and I guarantee at least one of them on that list is. And so jumping back up to the top here, omega-3 fatty acids are by far one of the most important things that we need for brain development besides movement, omega-3 fatty acids. And so if we're not getting enough omega-3 fatty acids, or these kids aren't getting enough omega-3 fatty acids, we need to supplement them with these things. And plants, obviously, get creative, do what you can in order to help these kids enjoy what they eat. And the other thing I want to add to this is probiotics, because probiotics, we need the beneficial gut bacteria, especially if the kids been on any rounds of antibiotics, because those antibiotics, they literally just wipe out everything. They don't care if it's good bacteria or bad bacteria, they just wipe it all out. So probiotics are essential in proper neurodevelopment, immune system health, and nervous system function. So immune challenges that we see with those deficiencies, this is kind of a different side to what we've been mainly talking about. But the sympathetic dominance weakens the immune system, and when we're deficient in these nutrients, then it's just harder for the body to process and to eliminate. So history of ear infections, sinus infections, allergies, asthma, all of these things, we see kids in our office and adults in our office with these things all the time. And sometimes we can tie these back to a little bit of the antibiotic use. And so our goal is to restore that function, not only through the chiropractic adjustment, but also through the diet itself and making recommendations there as well. So to sum it up, the two components that alter nervous system function are 1, sympathetic overdrive, and 2, the disorganized nervous system. And so we look to the spine as the middleman between your brain and your body, and we want to take care of it. We want to take care of the structure, because structure dictates function, as we learned about subluxation. So the immune system is controlled by the nervous system. It's all, the nervous system is by far the most important system in the body. why do we not get it checked? Why is there not something that is given to every child to check up on the nervous system, the health of the nervous system? And this is something that it's one of my goals, is to be able to have at least every man, woman, and child evaluated and checked for subluxation, because of the influence that it has on the nervous system and neurodevelopment, and also the immune system. So if your spine was on your face, of course you'd take better care of it, right? Because you'd see it every day. So number one recommendation is get to a pediatric chiropractor. And if you're watching this and you're not in the Boise area, for sure contact us and let us know where you are. I have a network of doctors that I would love to refer you to if they are in your area. And so just shoot us an email, find us on the website, give us a call, and we can help you out. But I want to be able to refer you to somebody who uses this technology to check the nervous system, to check the muscle system, to really give a full evaluation of how the child may be affected by subluxation. Okay. Number two, neural integration exercises and therapy, depending on the issue. We don't refer kiddos that come into our office with ear infections or with colic. We don't refer those kiddos out for neural integration exercises and therapy. But if you have a kid on the spectrum or sensory processing of some sort, even ADHD, our friend Andrea, she's amazing. She's at the sensory bin. She's actually the owner of the sensory bin, and they do a great job there, and that is who we refer our practice members to. Number three, clean up your diet and environment. We hit on a little bit of the diet and also on the environmental factors, but really where we can start is just by adding more fruits, more veggies, decreasing pesticides and preservatives, dairy and sugars. And so seek out the organic options. There are foods that you would probably want to buy organic, so that we're eliminating the preservatives and pesticides. Some foods are more important to replace organically than others. But the other thing that you can do is introduce essential oils, and we use essential oils in the office, and I use them at home with my kids and see awesome results with that. And so it's never just only one thing to consider. There are a lot of things to consider, and that's what we kind of put together and look at for each child. So number four, supplements. We talked about this, whole food multivitamin. Make sure the kiddo is getting enough vitamins and minerals, omega-3s, and I want to say make sure that they're DHA and EPA. The body has to go through an extra process for the other type of omega-3s. So just make sure that the omega-3 that you're getting is DHA and EPA. And for kids, if you're thinking, how in the world am I going to get a child to take fish oil or omega-3s? In the office, we do have kid omega-3s, and my kids like them. And so, the other kids that take them, it's easier for them to take, and easier for the parents to deal with. So contact us if you want some more information on that. Probiotic, I already hit on this a little bit, we want to optimize the gut function, because the immune system is contained within the gut, at least 70% of it is. And vitamin D, especially throughout the winter time, if you have an immune or if your kiddo's dealing with some immune issues, vitamin D is by far super important in the winter time, because you can go out in the summertime and they should be out playing and soaking up the vitamin D from the sun. Okay. Number five, play. We talked about this. Get outside, go do something, enroll them in swimming, martial arts, just get them active. Number six, unplug. Are you noticing how simple these are? I mean, these are all really simple. We just need little reminders, right? So unplug. Limit the amount of time limit their screenplay. That's what I just say in the office. Limit the screenplay and get them outside. Number seven, do not give up. Look, I know that this can be frustrating at times, and I know that it can be a challenge at times, but nerves that fire together wire together. And so if we're looking to change the how the brain is wired and how the brain is functioning because of the nervous system, it takes a little bit of time. This isn't just a one day, boom, you're done. This is a process. And so it'll take a while to get things under control, but stay the course. Do what you need to do, and I can guarantee you it will be far worth it. It will be worth it for you and for the child. So that is it. If you do have any questions or need to get in contact with us, please let us know. You can visit our website or just shoot us an email, give us a call, and we can help you out. These are a few kids in the practice that we've seen, and actually, this is I told you about that little girl that had fallen asleep immediately. Her sister was here to take a picture, and I was like, oh my goodness, we need to document this. This is incredible. This is a pure parasympathetic response. But anyway, these are some of the kiddos in the office, and we love seeing kids and adults, and basically really helping you find out what can we do to optimize neurodevelopment in kids and optimize growth and function in kids and adults. So typically I would take questions now. We're not live, and so if you have questions, you can throw them in below the video or shoot us an email or give us a call, any one of those. So hope you learned something. I really, like I said, it's really my passion to be able to help people understand a little bit more about health, empower you with knowledge, and allow you to kind of take the reins and do the right things that you need to. So I will leave it at that. I appreciate you guys being with me, and look forward to being in contact with you soon.